Hi, I'm Angela Lee. I am the Revenue Cycle Manager at Cure for the Kids Foundation. Our team is focused on helping the families find solutions for their financials when it comes to that aspect of the cancer treatment. National Children's Cancer Society survey from prior to the pandemic, 1 in 4 families lose about 40% of their annual household income due to treatment-related disruption. And with the pandemic, especially within our Las Vegas community, if we're just looking at hospitality industry alone, as of February 2020, right before the pandemic, we had 272,000 people working in the hospitality industry. As of May of 2021, that number is at 127,000. As of April 2022, some industries have recovered over 100% of their pre-pandemic employment levels. Hospitality has yet to fully recover and stands only at 90.5% of its pre-pandemic employment level peak.
I am a retail manager, so I was in the retail field where everything closed. It was dead. It was a dead job.
My husband and I were both laid off from our jobs in March of 2020?
And so it wasn't privileged for us to be able to have the COVID assistance program so we can identify the patients and the families who were financially impacted by the pandemic and helping them find ways to really take care of their co-payments, their deductibles, so that they can really focus their attention on their treatment and any other financial burdens that they really have outside of even our clinic.
So we ended up getting a call and I was like, yeah, I didn't authorize this. I don't know what this is. Like, no one told me what it is. And the lady on the other end, she's like, it's okay. This is helping you. I was like, okay. They had me sign and I was panicking, and she was like, no, she goes, we were, gifted in a way, like all this money to help people, and we knew what you guys were going through and we just put you guys on it. You could turn it down, you don't have to have it, but she's like, we wanted to take care of this bill, and we had been able to make our payments, but it's still, you still have to figure out where all your money is going to go.
Sometimes people are hesitant. People don't just jump at the opportunity to say, yay, I want to talk to you about my balance, because it is a very scary, scary thing to talk about outside of just everything else that comes with their child's diagnosis.
When we opened the bill, and this is after our insurance coverage, it was $300 a visit to go see Brooke, and sometimes that's like a couple times a week, and Jacob needs this. I found out the details and I was kind of freaking out, like I'm sure most of the parents do, and the representative here just really calmed me down and talked to me about some of the things that could help us with our bills, and they mentioned the COVID assistance, and I was like, wow, that would be great. And that's how then we went through the steps, and she helped me fill out the paperwork.
And when we are able to tell them you have been approved, those are our absolute favorite moments by our team, to be able to make that phone call or write that email to let the families know that you have been approved. You do not have to worry about the balances that you have here with us, because we have this wonderful program that is in place to help the patients that have been impacted.
I think it's an amazing program. We're so grateful. Like I said, you can't be worrying about making medical bill payments when your child is in the hospital. So it's just a huge relief, and we're so grateful that this program exists and that we were able to take advantage of it.
COVID assistance just really helps. It helps me, it helps everybody, it helps us basically to get through our days a lot easier. It helps us sleep, and it just takes some of the weight off.
I was sitting in the parking lot at work right before I went in, and she just called me and told me the good news. I almost cried. It was amazing. It was a relief, definitely.
Inevitably, you may have to end up making the tough choice of, do I get a box of cereal or do I pick up medication for my son from CVS? And these are choices that we, for some people, we've never had to face, right? And so I think that is part of something that's been very unique to the pandemic, that we, again, with this program, we'll be able to at least help to relieve, hopefully, a good piece of the financial burden that come with them.